Dr. Dalla Costa, thank you so much for joining us on MD Newsline podcast. Can you please introduce yourself to our audience?
Thank you for the invitation. I'm Dr. Dalla Costa. I'm from Italy, but now I am doing my practice and research at Harvard University in Boston. And I joined the group of Professor Askerio, where we are carrying out research on different environmental risk factors for neurological disorders.
Interesting. So tell me a little bit about some of the risk factors that you have found recently that you're focused on, and then I want to talk a little bit about processed food.
Yeah. I focus mainly on multiple sclerosis, and we focus on different environmental risk factors, particularly on Epstein-Barr virus, on vitamin D levels, and now we switch it to ultra processed food. That is a new emerging interesting topic.
So, what inspired the investigation into the relationship between processed food, metabolic signatures, and disease activity or progression in MS, and how does this concept fit with emerging disease paradigms?
Recently there have been a lot of studies published in other disorders about the relationship between ultra processed food and different outcomes. As I said this morning, for example, there have been papers published in the last couple of years showing how high intake of ultra processed food is associated with an increased risk of different type of cancers, and then a 17% increase in the risk of cardiovascular diseases, and also a 10% increase in all-cause mortality. And there is also been evidence that ultra-processed food is linked to an increased level of inflammatory markers in general. And so we thought, well, let's explore this. We have the data to do this. Let's explore this topic. And so we came with this project.
Interesting. So, can you talk a little bit about more what those metabolic markers are and how they're measured?
Investigating, estimating the uptake of ultra-processed food in a population is a complex task, because the food questionnaire to quantify the amount of ultra-processed food a person is assuming is really extensive. And so a shortcut to this is to measure on the blood or on the urine certain molecules, circulating molecules, that have been proven to track the levels of ultra-processed food a person is consuming. So one can take simply the blood of a patient, in this case, of a person, and measure these metabolites, and then apply validated signatures, so a combination of metabolites that are proven to reflect the amount of UPF a person is taking. And technically, this is a simple assay one can carry out on blood samples. So that's it.
So, what is the general thought around why ultra processed food is bad and why it might be related to MS disease progression?
We found interesting results from our study that partially also confirm previous evidence about the relationship between ultra-processed food and inflammation. And there is, so far we have found these results, but the mechanism, so the biological mechanism for which this ultra-processed food is linked to this inflammation are yet to be understood. We can do some hypotheses. We can make some hypotheses. For example, there are a class of metabolites called ceramides, and they and ultra-processed food are related to some metabolites belonging to this class. So we can suppose that maybe this interfere with the structure of the cellular membranes, and so cellular membranes they may be unstable, and so they may be more prone to be damaged in certain kind of diseases such as multiple sclerosis. But for example, there are other metabolites linked to the UPF, so inside the UPF signature, such as, for example, C4-hydroxycarnitine, and these are involved into the cell metabolism. And so we can speculate that these metabolites interfere with the cell energy production, with the energy production by the cells, so impairing the capacity of cells of repairing after damage.
That's fascinating. I wonder, just long term, what were some of the patient populations or populations of people that you included in your study, and just tell me a little bit more about some of the things that you found out in that study.
Okay. So we carried out in this study in a population of patients that has been extensively studied. It's a clinical trial that has been carried out on patients with early multiple sclerosis. And these patients were randomized at the time between interferon beta 1b and placebo. And they have been followed up with extensive monitoring for several years. So we took advantage of this cohort, and we analyzed 451 patients that had baseline plasma samples and had full data up to 5 years after the onset of the first symptoms. So we measure OPF intake on blood samples at the beginning, and then we had periodic MRI data and clinical observation up to 5 years after the enrollment. And what we have found is that there is not an increased risk of developing multiple sclerosis according to the different amount of UPF intake, but actually patients who develop multiple sclerosis are at increased risk of relapses. So they experience 30% more relapses than patients with lower OPF levels. And also, different MRI parameters support this information, these findings, as we found that patients with the highest level of OPF had worse MRI parameters along the follow-up. So, an increase in T2 lesions and T1 lesions at MRI that we consider a bad marker of disease progression.
When you look at what is involved in ultra processed foods in the creation of it, what are some of the factors that make something count as ultra processed?
Sorry?
What are the factors that qualify food to be in the ultra processed category? What makes it ultra processed compared to other food?
Yeah. Well, that's an interesting question. The concept of ultra processed food has been introduced like 15 years ago by a research group that was studying different food type, and they classify food according to the ingredients and to the processing. And they came out with this classification called NOVA classification, where food is divided into 4 categories. So there is the category of no processed food, for example, vegetables or raw meat. Then there is mild processed food, and then there is processed and ultra processed food. Well, ultra processed food is a category that comprise food derived from natural sources, but so the addition of additives, colorants, or other emulsifiers, and these substances basically are added to food to make the food hyper palatable and convenient also for the seller because it's cheaper and so on. But actually, it turns out that for the customers, this is not a good thing from the results we are seeing.
Talk to me a little bit about how metabolite panels for ultra processed food intake validated and selected, and are there particular metabolites that best reflect ultra processed food consumption in MS?
No, we use the overall signature and related the overall signature score to the different outcomes, and we have not tested the singular metabolites against the outcomes.
Are there any trends or changes in MS disease presentation or progression that reflect or correlate with the increased intake of ultra processed food in general? or
Uh,
has anyone looked at that?
we look at the predictors of the amount of OPF a person has. And we found interesting things. First, we found that people with the highest level of OPF usually have also other bad habits. For example, usually there are smokers. They are more prone to be obese. And a second interesting factor is the fact that there are regional differences in the amount of UPF you can find in the blood. For example, we found that people in North America tend to have higher level of UPF in comparison, for example, to people from the southern part of Europe. So this is another interesting fact we found.
Mm. Interesting. When patients present, or people in general, like when we see that, okay, ultra processed food is not the best for us, right? Um, are there any types of diet that counteract ultra processed food, kind of focused damage that might be done? Like, what if an MS patient is might be more likely to relapse the more ultra processed food that they intake, then what should they be eating, and what are the recommendations?
Yeah, actually, there have been studies showing that a sort of Mediterranean diet is best for this kind of neurological conditions. But there is yet a study to show, how much OPF are present in a person consuming a Mediterranean diet. Also, there are new studies showing that, following a Mediterranean diet, one can improve his general condition. So we are talking about a condition that is degenerative. There is chronic inflammation, and what we aim to do with our suggestion of considering also this aspect, this modifiable aspect of a patient's life, is try to try to reduce the amount of ultra processed food a person consume, because it's a cheap and strategy to suggest to patients. But in addition to current therapies, because current therapies have been validated against placebo, whereas our study has been not, validated in a clinical trial. So our results have not been validated in a prospective clinical trial. So one can use this strategy in addition to all the other currently validated therapies.
I want to make sure we get to all the main takeaways of your presentation. Please tell me a little bit more if there's something that we haven't covered about the presentation that you gave.
Um, well, no, I think we cover mostly everything.
Yeah.
Um, Let me think. No, I think we cover almost everything.
No problem.
Yes.
So, let me see. I have a few more questions. So, talked about inflammation. Could specific food additives or processing byproducts like emulsifiers, preservatives be contributing to metabolic impact? We talked about a little bit about preservatives, but are there other processes that you feel like might contribute to the negative impact of ultra processed food?
Yes. As I said, probably these are the elements, the causative elements of this association that we are seeing. But we have yet to test singular elements. How each singular element contribute in the end to the chronic inflammation. So as a whole, we suggest to consume less ultra processed food in general, and we cannot say, being specific about this or that type of element to try to avoid absolutely this or that one. But in general, the less ultra processed food a person consume, it appears from the literature and from our results that the best it is.
Mhm. Where do you see this research taking us in the next few years? For instance, is there maybe potential for um, understanding ultra processed food to be part of even further personalized medicine, or what is your outlook on the research in the future?
Well, first of all, I would be interested to delve deeper into this topic and try to unravel the mechanism for which this ultra-processed food led to chronic inflammation. So, the first thing that we would like to do is to explore the relationship between the consumption of ultra-processed food and the gut barrier. So we would like to analyze gut-derived metabolites in relationship in relation to the consumption of ultra-processed food. So I think a first field would be to investigate the mechanisms through which this ultra-processed food may cause damages, and then subsequently, I think it would be interesting to try to do a trial to validate our findings and see as an add-on therapy how this perform.
Interesting. When you talk about the gut, it reminds me about, in the world of MS, I've heard a lot of conversation around things passing the blood-brain barrier, for example, right? And when I think about things crossing barriers in that way, I'm also thinking about things like acid reflux, for example, and how over time that can damage membranes and stuff like that. Have you all kind of thought about things like acid reflux or gastritis and how ultra processed food might impact it, or is that a factor at all in conversation?
Yes, we aim to explore better all these factors and
Mm,
subsequent research. Yes.
interesting. What limitations should clinicians and researchers consider when interpreting findings from meta? Just a second. Let's finish. The question was going to be when interpreting findings of studies about diet and MS, including risks of confounding or reverse causality. I think we've already talked about that a little bit. I know we've both had a long day, so I'm sure your day's been long. Um, yeah, when you think about ultra processed food, right now we're in Barcelona, but things are a lot different in the U.S. Right? What implications do some of these findings have on things like dietary policy, population level MS prevention, or chronic disease management generally? Where do you hope to see this influence?
Well, what I hope is that this finding may contribute to improve at least, I mean, the life of patients with multiple sclerosis. And my hopes is that this finding will enter a clinical practice as, for example, vitamin D has done. Now, because now, for example, is widespread the use of vitamin D not just to prevent osteoporosis, but also as a therapy, as an add-on therapy for the management of multiple sclerosis. So, my hope is that together with advising patient against smoking, together with advising patient to take vitamin D supplements, my hope is that a clinician will become aware of the importance of ultra processed food, and they will advise patients against the consumption of too much ultra processed foods.
Are there populations or subpopulations that seem to be more impacted on this than others? Are there any maybe demographic protective factors or factors in demographics that you see make people even more susceptible to the negative effects of ultra processed food?
Well, we haven't explored this yet, but of course, I think there are demographic factors because, and also sociocultural elements that would drive the consumption of ultra processed foods. I think, in general, as we have seen from our results, but also there is previous evidence showing that, in general, for example, in North America and among European countries, the UK are the region with the highest consumption of ultra processed food. Maybe because of the availability of prepared food in comparison to, for example, Italy, Spain, or Greece, where there is more of a culture for cooking at home and doing and cooking a person cook his own meals. So yes, I think there should be demographic and cultural differences in this, but we have to explore better this.
What advice would you give clinicians interested in incorporating dietary conversations into MS patient care or research?
Now there are a bunch of evidences of sustaining the use of supplements with vitamin D, and now some evidence from ultra processed food from our study. And so I think a clinician should be aware of these emerging evidences, and there are also studying showing that different type of diets lead to different type of outcomes. And so I think a clinician cannot become a nutritionist, but in general at least make a patient aware that these are modifiable factor, and he can play a role in his own disease by paying attention to this.
Are there any misconceptions common among medical community members regarding ultra processed food exposure and MS inflammatory disease mechanisms that you wish to clarify? Is there
No, I think there are very few studies on ultra-processed food so far in relation to multiple sclerosis, in relationship to multiple sclerosis. So, so far, no misconception, I think.
How do you see machine learning and AI playing a role in your work in the future? Because there seem to be so many factors, with food processing and things like that. There are a million things that come into play. How do you see technology helping you kind of do this research yourself in the future? How do you hope to see it being applied for other people that are doing adjacent work?
No, I think machine learning and AI will have a huge role in the future, because we are talking about personalizing treatments, and I think we can personalize treatment just through use of these tools. So also for these modifiable factors such as vitamin D, such as ultra processed food, personalized advice will rely on this tool. So yes, they will play a huge role in the future.
Fascinating, fascinating. Thank you so much for taking the time to talk to us here on MD Newsline. I'm so glad I got a chance to learn about your work, and I look forward to more research in the future and what you're going to tell us about ultra processed food, because I feel like, it's something that we all know, but we
Yeah,
don't
but we have
exactly
all,
know
yeah.
why. And we're like, I know this is bad, and of course there's a
Yes.
lacking of nutritional value, but it's the you know, are I'm wondering, are there any regulations comparing the US to other countries, and you don't have to talk about this, you don't feel comfortable, but I'm wondering, when it comes to how we kind of talk about our food from a regulatory perspective, is there anything that you look forward to seeing implemented specifically?
As this new evidences relating this kind of foods to different disease outcomes emerge, I think also the general policies in the different Western countries probably will adjust accordingly. So probably we will see acceptable threshold for different additives change, I hope, in the future.
Mhm. Thank you so much. And are there any additives specifically that you feel like might be worse culprits than others?
I cannot say this because, as I said, we studied the signature
Yeah.
of UPF intake as a whole.
Yeah.
So I cannot point my finger toward this or that
Mm-hmm.
substances contributing to a food to be defined ultra processed.
Mm-hmm.
So
Yeah, it'd be interesting to see if somebody
yeah,
pinpoints that in the future. I'm sure people have their thoughts,
yeah.
but yeah, I'll be excited to see the evidence. Okay, thank you so much for joining us. It's been a
Thank you for
pleasure.
the invitation. Thank you.
Absolutely.